When it comes to managing your health, particularly diabetes, one of the most important measurements doctors use is the A1C test, also called hemoglobin, A1C, or HbA1c. This blood test is a crucial indicator of how well your blood sugar has been controlled over the past few months. Unlike daily glucose measurements, which fluctuate based on meals, exercise, stress, or sleep, the A1C test provides a long-term view. Think of it as a report card for your blood sugar over the last 2 to 3 months. What is A1C? A1C is short for glycated hemoglobin, a type of hemoglobin that has sugar attached to it. Hemoglobin is a protein found in your red blood cells that carries oxygen throughout your body. Over time, glucose in your blood naturally binds to hemoglobin. The more glucose in your blood, the more hemoglobin becomes glycated. The A1C test measures the percentage of hemoglobin that is glycated, giving a reliable estimate of your average blood sugar levels over the past 2 to 3 months. Red blood cells live about 120 days. A1C reflects blood sugar control during that time. Higher A1C leads to more glucose attached, leads to higher risk of diabetes complications. In short, the A1C test is a long-term marker of your blood sugar, unlike finger prick glucose tests, which only measure blood sugar at a single moment. Why is A1C important? The A1C test is important for several reasons. 1. Diagnosing diabetes and prediabetes. The A1C test is commonly used to diagnose diabetes and identify prediabetes. It gives doctors a clear picture of how consistently high your blood sugar has been over time. Normal, below 5.7%. Prediabetes, 5.7% to 6.4%. Diabetes, 6.5% or higher. Early diagnosis is critical. Elevated A1C levels can help doctors intervene before complications like kidney disease, heart problems, or vision loss occur. 2. Monitoring diabetes control. For people already diagnosed with diabetes, A1C is a key measure of how well blood sugar is being managed. It shows the effectiveness of diet, exercise, and medications. Helps doctors adjust insulin doses or other medications. Motivates patients, showing how lifestyle changes impact long-term glucose levels. 3. Predicting risk of complications. Research has shown a strong link between A1C levels and the risk of diabetes-related complications. Heart disease and stroke risk increase with higher A1C. Kidney disease, nephropathy is more likely with sustained high blood sugar. Eye problems, retinopathy and nerve damage, neuropathy are associated with elevated A1C. Lowering A1C, even slightly, can significantly reduce the likelihood of long-term complications. How A1C is measured. The A1C test is simple, requiring a blood sample taken in a clinic or lab. No fasting required. Unlike some glucose tests, you don't need to fast before an A1C test. Blood drawn from a vein or finger prick. The sample is sent to a lab for analysis, result reported as a percentage. The higher the percentage, the higher the average blood sugar. Modern labs may also report estimated average glucose, EAG, converting A1C into a number similar to daily blood sugar readings in milligrams per deciliter or millimoles per liter. Example, conversion. A1C 6% error. Average glucose 126 milligrams per deciliter. A1C 7% error. Average glucose 154 milligrams per deciliter. A1C 8% error. Average glucose 183 milligrams per deciliter. This helps patients visualize their long-term blood sugar in more familiar daily terms. Interpreting your A1C results. Understanding what your A1C result means is crucial. A1C %. Average glucose milligrams per deciliter. Interpretation: below 5.7, less than 117. Normal 5.7 to 6.4, 117 to 137. Prediabetes 6.5 to 7, 137 to 154. Mild diabetes well controlled 7 to 8, 154 to 183. Moderate diabetes may need lifestyle or medication adjustments 8 to 10, 183 to 240. Poorly controlled diabetes above 10 greater than 240. Very high risk of complications. Urgent action needed. Note: target A1C varies. For most adults with diabetes, the recommended goal is around 7%, but some individuals may need slightly higher or lower targets, depending on age, health conditions, or pregnancy, factors that can affect A1C accuracy. While A1C is highly reliable, some factors can influence its accuracy. 1. Hemoglobin disorders like sickle cell disease or thalassemia. 2. Anemia or other conditions affecting red blood cell lifespan. 3. Kidney or liver disease. 4. Recent blood loss or transfusions. Doctors may use alternative tests like fructosamine in these cases. Lifestyle changes to lower A1C. For most people, A1C can be managed or lowered through lifestyle changes. 1. Diet focus on low glycemic index foods like whole grains, vegetables, and legumes. Limit refined sugar and processed carbs. Include healthy fats like olive oil, avocado, and nuts. 2. Exercise. Regular activity lowers blood sugar by improving insulin sensitivity. Even 30 minutes of walking daily can make a difference. Resistance training also helps muscles absorb glucose. 3. Medication. For diagnosed diabetes, medications like metformin, insulin, or SGLT2 inhibitors help control glucose. Always follow your doctor's guidance. Do not adjust medication without consultation. 4. Stress management and sleep. Stress and poor sleep can raise blood sugar through hormones like cortisol. Mindfulness, meditation, and consistent sleep schedules support lower A1C. Why A1C matters more than daily glucose. Daily blood sugar readings show short-term levels, but A1C reflects long-term trends, making it a better predictor of future complications. Example: 2 people might have the same morning glucose reading of 120 milligrams per deciliter. Person A's A1C is 6%, generally stable sugar levels. Person B's A1C is 8%, frequent spikes and high sugar over time. This highlights why doctors rely on A1C for overall diabetes management rather than single readings. Special considerations. During pregnancy, blood sugar control is critical to avoid gestational diabetes complications. Doctors may monitor A1C early in pregnancy, but daily glucose monitoring is usually preferred later. Children and adolescents. Targets may differ for young patients. Doctors usually aim for slightly higher A1C to avoid hyperglycemia risks while still preventing long-term complications. Older adults. For older adults with other health issues, slightly higher A1C like 7.5 to 8% may be safer to prevent dangerous low blood sugar episodes. The A1C test is a window into your long-term blood sugar health. It is simple, powerful, and life-saving. Understanding it, monitoring it, and acting on it can prevent serious complications and improve quality of life. Even if you feel healthy now, checking your A1C regularly is a proactive step toward protecting your future. Check your A1C today and take control of your blood sugar before it controls you. Watch our full video to learn exactly how to interpret your A A1C and take steps to lower it safely.